Good evening, everyone, and welcome to March's meeting of the Customer and Corporate Services and Scrutiny Management Committee. Before we begin, I shall just quickly remind you that we're being webcast live and we're being recorded for posterity. I know that we're all very familiar now with the way these meetings work, but just on the tiny off chance that someone at home is watching for the first time, welcome. It's very nice of you to join us, and here's how the meeting will work this evening. Participants have been asked to keep themselves on mute at all times unless they've been invited to speak, and to indicate their wish to speak, they raise their blue hand button within Zoom, which is visible to me as the chair, but not to you sitting at home. So I'll then invite members to contribute in the order that I see their hands going up, unless I see members indicating to speak for the first time when others have been speaking and asking quite a lot of questions. The only exception to this is when participants are wishing to make a comment or ask a supplementary question that is pertinent to the specific issue being discussed, as opposed to starting a new line of questioning. And in this instance, participants can draw my attention by physically raising a hand, and I'll bring them in if I can. Members of the committee are going to be joined on screen throughout the meeting this evening by Janie Berry, who is the Council's Director of Governance and the Monitoring Officer, and by Dawn Steele, who is Head of Civic and Democratic Services. Off screen, we have a Democracy Officer who'll be taking minutes, and we also have technical officers supporting us. Additional participants will be joining us at specific points throughout the meeting, and so I'll be introducing them as they join us on screen. As usual, I'll be looking to take a short adjournment at an appropriate stage at around the halfway mark of the meeting, just to give everyone's eyes a rest. So on to apologies. I haven't received any apologies for this evening's meeting, although Councillor Mason is running slightly late, and so will be joining us just as soon as he can. On to the formal agenda. Item 1 is declarations of interest. Do any members wish to declare an interest in respect of any item on this evening's agenda? Councillor Kilbane.
Oh, thank you, Chair. As the part owner of a hospitality business in York, I have a non-pecuniary, non-prejudicial interest potentially in item 5.
Thank you. Don't see any further indications, so I will move us on to agenda item 2, which is the minutes. We've got just one set of minutes to check this evening from last month's meeting on the 8th of February. Is everybody happy that I sign them as an accurate record of the meeting? If I can just see a show of hands from everybody. That's fantastic. Thank you very much. And there is an ever-growing pile of minutes, I'm sure, waiting for me at West offices. So I look forward to getting to them as soon as we can. Item 3 is public participation. We don't have anybody registered to speak this evening, so we can get straight on to business. Agenda item 4, which is the Q3 finance and performance monitoring. So if I can invite Debbie Mitchell, who's the Chief Finance Officer, and Ian Cunningham, who's Head of Business Intelligence, to join us on screen. Very welcome this evening, and I think usually Debbie, if you could perhaps just talk us through, and then Ian, I don't know if you wanted to add some additional things once Debbie's said her bit, and then I'll invite members to ask questions.
Okay, thank you, Chair. Good evening, everyone. So this is the third quarter finance and performance monitoring report, and the report outlines the finance and performance position as at the end of December 2020. So just draw your attention to the fact that this means the report and the figures contained within don't therefore fully reflect either the potential financial impact on income streams as a result of the current lockdown that we're in, because it was prepared just before we went into this lockdown, and nor does it include any of the additional costs that we might have incurred as a result of the recent flooding in the city. And at the time we were writing the report, the Prime Minister had only just announced the plans for easing the restrictions. So again, the figures don't include any impact that this may have, although hopefully or presumably not too much of an impact in this financial year. The report and the annexes outline the key issues across all areas of the council, although again I would draw your attention to note that some of the other individual scrutiny committees might consider some of those areas in a bit more detail, although clearly you're able to ask questions on those areas, of course. So COVID clearly continues to have a major financial impact on the council. The report highlights a range of other budget pressures, particularly in both adults and children's social care, alongside the COVID impact. And I would again draw your attention to the fact that the main cost pressures that we are experiencing as a result of COVID and social care clearly national issues that are affecting many other councils across the country, and will require government intervention to fully resolve how local government is funded in the future. The summary position from a financial perspective is outlined in the table at paragraph 12, shows a forecast overspend of 3.7 million. The report then goes on to outline some of the mitigation and other actions that are being taken to try and deliver on this forecast, and work is clearly continuing to manage the overall position. I also finally just need to make you aware that potentially these actions will not be able to manage the position to the point that the budget will balance overall, and that if that is the case, we will need to call on the council's general reserve. So clearly we've faced an unprecedented set of circumstances over the last 12 months or so, and the reserve is held to deal with exactly this type of emergency and unexpected pressure. So from my point of view, using reserves, if we have to balance this year's budget, is an appropriate short-term option, especially as the 21-22 budget that was recently agreed at full council does make provision both for future COVID pressures and for growth in the budget in social care. And like I say, detailed analysis of both finance and performance issues across all areas of the council is included in the annexes to the report. I'll leave it there.
Thanks very much, Debbie. Ian, I don't know if you wanted to add anything at this point.
Thanks, Chair.
Yeah.
I would just probably echo some of the points that Debbie's made. So just the information from Q3, a significant amount of both the performance directions of travel and the availability of performance information have been affected by COVID over the last year. There are some good areas of performance within the council around some of the strategic indicators outlined in paragraph 20, whether that be some resident feedback or some of the operational services. In paragraph 22, we've outlined some of the indicators that we would like to track that have been adversely affected by COVID, the availability. And in paragraph 23, there's an area of performance which, as a council, we're looking to tackle. So yeah, I think that's probably the key patterns there. Thank you.
Thank you very much. So I'll invite members for questions. If you could just indicate, just before I go to questions, and Councillor Fenton, I've seen you very quickly there. Debbie, you mentioned about the recent costs due to flooding, which might affect these figures and aren't included in there. Are you able to just give us a very brief ballpark indication of what those sort of costs may be in addition to anything else?
I'm not, I'm afraid, at this point in time. I haven't got that information to hand.
Okay.
So, but I can find that out and let you know, circulate to the committee afterwards.
Thank you very much. Thank you. So, Councillor Fenton.
Thank you, Chair, and thank you, Debbie and Ian. Just a question for Debbie. In the table at paragraph 12, the forecast variation in from central budgets of £900,000 underspend. Just wondered if you could give us an idea of how that breaks down in terms of are there savings we've been able to make because of the pandemic in terms of changed ways of working? Is it through vacancies that have been held up and are not recruited to? So it'd be useful to understand how it how it breaks down, and obviously with continuing pressure in next year's budget, whether you think some of the savings that we're obviously realising this year will be could also be realised in future years, or whether this is very much a one-off set of circumstances that obviously will overall help the overall position, but to what extent is this a sort of a one-off saving on that line? Thank you.
Yeah, so the 900k underspend is referred to in under the corporate budget section in the annex. It's page 32 of the pack, and it really is it's an underspend on the minimum revenue provision. So what we've been able to do is and we've been into this in a bit more detail at Audit and Governance Committee, is what we've been able to do is look at the minimum revenue provision, which is the amount that we set aside for the repayment of debt. And the way that we calculate the minimum revenue provision is on a formula based on the life of the asset. And what we've been able to do is look in a bit more detail at those assets. So we put them into categories, and we've essentially dropped down a level of detail. And when we've dropped down a level of detail, we've realised that some of the assets we'd put over too short a life. So we'd put some assets in a category that was for things like IT, where it's a life of 5 years. And we looked, and some of those were different assets that meant we could do them over a longer life of 10 to 15 years. And I'm probably not explaining this very well, but what that means is that we stretch the repayment of debt over a longer time period, and therefore it's a lower amount in each year. And that we've been able to carry that on, and you'll note in the budget that was approved at full council last month, we've included that as an ongoing saving in future years, as a recurring saving as a result of reviewing those financing assumptions. In terms of your wider point around savings as a result of COVID, so savings from people not being in the office, that again, those savings in individual areas will have been included in the directorate position. And I think we've also got in the budget a saving from things like cost control, where we've wrapped up any savings as a result of either reduced printing or just not, staff travel and that kind of thing, have been part of the budget proposals that were approved last month.
Thanks, Debbie. Councillor Kilbane.
Oh, thanks, Chair. Just on the housing revenue account, I noted that we've got a forecast shortfall relating to rents due to the delayed opening of James House and Lincoln Court. I think that might be one that we could ask questions about in Economy in Place. I'm not expecting you to know the answers to that as to why the late opening. Would you know that?
There were a lot of delays with the contractor. I think again that Ian might know a bit more about that. No.
Okay.
So
no, like I say, it's just,
there were some delays with the contract, and there was a period of dispute, and that was resolved with the contractor. So I don't know the individual detail, but there's quite a lot of information about that. So if it was an area you wanted to look at more closely, we can do that.
Look at that. Okay, thanks. Sorry, my question was to Ian really, with the in terms of focusing on paragraph 23 and the indicators that you want to work on. One of those, the standout one of those, unfortunately, is the fall of life expectancy for poor women in York, actual decrease in their life expectancy. What are we thinking? What are you thinking of? How are you looking to tackle that?
Thanks, Councillor Kilbane. I'm not sure I can quite answer it in terms of policy decisions that we're making around that.
So just the areas of work that you're looking at, really.
Yeah, I guess Fiona's coming on in a bit around public health and public health interventions, and that might be a question that you want to bring up with her in her section.
Oh, okay. So I must have got you wrong. Sorry.
Yeah,
I thought you said you were targeting those
interventions.
Yeah. All right. Okay. All right. Okay. Thanks.
Thanks, Ian and Debbie. I think that that's probably something that we might, as a committee, want to think about asking Health Scrutiny to look into in some more detail, because that was certainly something that jumped out at me. Declining situation for women in York, and particularly it being International Women's Day as well. I think it's a worry and a concern. Councillor Fenton, your hand's up again if you'd like to ask another question.
Yeah, just to add to that, in terms of looking at things that obviously Ian can't answer here and now, but it should be picked up at, I think, at some point. Paragraph 36 on page 40 talks about an increase in the percentage of Year 6 children found to be obese in 2019-20 compared to 18-19. That obviously is a worrying trend. So again, that's another issue that it'd be, I think, helpful to look into and sort of better understand, either through a report from the public health team, just sort of setting out how the data is gathered and how that measurement is arrived at. But it's again, something in addition to what was previously mentioned is be worth adding to the list. Thank you.
Ian, did you want to answer that?
Yes, just for Councillor Fenton and for the committee, I'll make sure for the Q4 report that both those issues that were raised have a little bit more detail about them. So when they come back round to the CSMC committee, you don't need to go to other committees for it. Okay.
Thank you. That's helpful. Councillor Kilbane, I see your hand up, but I'm going to jump in and use my discretion to ask a quick question whilst I can. And it was just a question, Debbie. I think it's probably a question for you, and it's kind of an accounting issue, I think, rather than anything else, because I'm just a bit confused, to be totally honest. So if you go to page 26, where we've got health, housing, and adult social care, there's a whole series of paragraphs that follow that. So sort of paragraph 32 all the way through to paragraph 46, and not every single paragraph, but almost every single paragraph says that there's an overspend of X amount, and then the next paragraph is there's an overspend of X amount. And I went through and I totted up all the ones that I thought were certainly council spending and all of the council overspends, and it comes to 8.9 million of overspend. The total underspends that I could see listed were about 500,000, and then there's sort of a reference to mitigations and things, but I couldn't see anything sort of specific. Then when you go to the table on at paragraph 12 on page 9, the overspend for health, housing and adult social care is 2.685 million. So there seems to be quite a significant discrepancy between the cumulative overspends and the sort of outturn overspend or projected overspend in that directorate, without any clarity over such a large amount of mitigation that there must presumably have to be. And I just wondered if I've misread it, and perhaps if there's overspends that are not directly related to the directorate contained within that. If you could just give me a bit more information, that'd be really helpful.
No, you haven't misread. That's probably my fault, because we tend to focus on the areas of overspend because they're the areas that we think we need to draw your attention to. And what I haven't included is some of the underspends and other mitigation. So that's probably my rather pessimistic accountancy type outlook, trying to focus your attention on the areas that I think are of concern, and not maybe highlighting some of the underspends and some of the mitigation where, so the use of different grants and the use of COVID funds, etc., to offset some of the pressures. So yeah, I'll take that on board and make sure that I include some more of that in future reports.
I think that would certainly be helpful, because, as I say, my sort of back of the fag packet type calculation is that there's about 6 million difference between the figure in table 12 and the total cumulative amount of overspend. So that must be quite a lot of mitigation, presumably a lot of services not being delivered, potentially grants coming in, maybe. I don't know if you, off the top of your head, are able to give us any indication of any of the big ticket items in there.
It's a whole range of things, really. There's certainly a couple of million of grants, so the Contained Outbreak Management Fund, the COVID grants and other grants that are being used in that area. So, and again, as you'll appreciate, it's a big area and there's a lot of detail. So this is the edited highlights of the areas that I feel I need to draw to your attention. It's not a complete list of all the different variations. It is just the key issues. So yeah, it's just reflective of picking out of key issues.
Thank you. I appreciate that. And just note that Councillor Mason's now arrived. Very welcome. Good evening. We're just at agenda item 4, looking at the Q3 finance and performance monitor. So Debbie, just last question on that, and then I'll bring Councillor Kilbane in, who's also indicating for a question. So you mentioned there that there's a couple of million from things like COVID grants and what have you. That's not the same as the 2.5 million COVID grant fund that's been identified within the budget. That's something separate and different.
Yeah, it's just the use of grants to offset some of the pressures that were, some of the grants and the expenditure that they're designed for, and just how we present those.
Thank you. So Councillor Kilbane.
Thank you, Chair. It's a question, Debbie, about the adult social care. and the upward pressures that we've had on it during the pandemic. I'm just trying to work out, is it all increased costs? So if you get an example of somebody that was getting, I don't know, 12 hours of adult social care a week, and suddenly that went down to 6 hours because of it was done on the telephone instead of in person, for example, would that not reduce the costs? Has there been no sort of offset from the fact that people are getting less adult social care because of the COVID restrictions, or getting it in a different way, and it's taken less time?
No, it's the opposite. People are getting more social care because of COVID, because in particular, perhaps somebody might have family and friends nearby that would do some of that care as you would care for family members, and due to restrictions of social distancing, they've not been able to go in and support their family members in that way. So the council has had to provide them with home care. They've also again, as you would expect, particularly elderly and more vulnerable people who are more susceptible to the impact of COVID and the impact of so-called long COVID, meaning that those people that already had health issues have been hardest hit by COVID and have had more severe symptoms for a longer period of time, have taken longer to recover. So the reverse has been true in that we've been using more home care than we've done before, just because we've got more people who haven't got family and friends nearby who are able to help out.
So we've not seen a reduction in costs at all for anyone?
No.
Okay, thanks.
No.
Okay, thank you. I'm just looking for any further hands, but in the absence of those, I will just ask another question, which again I think probably is for you, Debbie. And again, it's possibly a bit about an update of data, and I'm not sure whether you'll have it or not. But page 25, paragraph 26 talks about the dedicated schools grant position, and it was in deficit of 4.865 million. I remember this paragraph from the Q2 Finance and Performance Monitor, and it was saying that the year end, it could reach as high as 10 million. And we are somewhere near the year end now. I'm just wondering if you've got any indication as to whether we are anywhere near 10 million, whether that 4.865 figure is about where we are, or where we are somewhere in between those two figures.
Yeah, it's a strange thing in finance that the nearer you get to the year end, the less certain you are of your forecast, which I realise might feel counterintuitive, but the nearer we get to the year end, the more jumpy I get about making a forecast. So a lot of the expenditure won't come in until the year end. So I'm afraid I haven't got an update for you in terms of the number, but there is a lot of work ongoing with the Schools Forum, who are the group that agree the spending of the dedicated schools grant, to look at a recovery plan and how we can resolve the current pressures within that area. So there is a lot of work ongoing. We can bring a further update on that to a future, as part of a future monitoring report, because that's all linked with the schools forum, but I haven't got an update on the number, I'm afraid.
No, I appreciate that. I think last time we discussed it, I did ask the Children Education and Community Scrutiny Committee to look into it a little bit more. So if there's any more detail that you can send their way, I think that's probably the best way of managing that. I'm looking for further hands beyond Councillor Kilbane, who has got his hand up again. I'm very happy to go to him, but if anybody else does want to jump in, I will prioritise you. But in the absence of that, Councillor Kilbane.
Sorry, Chair. It's my last question of the night, honest. Just Debbie, just in relation to the reserves and then maybe the need to spend them on, particularly on social care for adults and children. There's about 7.4 million in general reserves. How much of that could we be looking at spending in this financial year? All of it, half of it?
Well, in theory, the 3 point, sorry, forget my forecast now, whether it's 3.7 or 2.7. In theory, the 3.7, so the 3726, which is the amount that we were forecasting at the end of Q3, I would, again, be careful about saying this, I say this every time, I would hope that would improve, but I'll have said that at Monitor 1 and Monitor 2 and been proved wrong, so maybe I should stop saying that. if that is the outturn position, then we would need to take probably 3.7 million out of the general reserve. So that would, around about half of the general reserve. We do have, so the target for the review of reserves, which is the 1.5 million in that table, that is a review of earmarked reserves to make sure that we're not hanging on to earmarked reserves when the issue has been resolved and we no longer need to. So we will be looking everywhere. We will be clearing out all these reserves and anything that we think isn't needed, because obviously I will want to minimise the call on general reserve just because of the pressure that I'll put the council under financially next year to make sure that we've got a sufficient reserve, because clearly COVID doesn't end on the 31st of March, so fully expect there'll be other pressures throughout the year, and we've got £8 million worth of savings to deliver as well next year. And I can't guarantee from a finance point of view that all those savings will be delivered on time in the year. It's always something unexpected that could happen that could delay those savings or reduce the amount. So we would, if we do have to use as much as 3.7 million from the general reserve, we'll need to look at where we can go next year in that. So there'll be further work to do.
A supplementary there, Councillor Cobain.
Yeah, honestly, the last question. Whereabouts the earmarked reserves? Whereabouts are those? What are we looking at pulling the money away from?
We won't be taking the money away from anything. More review what we've got. So we've been looking at things. I can't think off the top of my head what they are. I have got a list of them, which when we get to the outturn and any reserves we use, we will do a full list in the report. But it would be, for example, I don't know if we've got anything left in this reserve. For example, when we had the Lendal Bridge charging and we repaid all the fines, we couldn't find everybody. So there was some left over, which we put in a reserve to wait just in case we could find any more people. Probably got to the point now where that's done and dusted. We don't need to keep hanging on to that reserve. It's that kind of thing where we were keeping it for a particular purpose or to deal with a particular risk, and we'll review those risks and review those purposes. If that risk has been mitigated or has gone away or something else has happened, we no longer need to keep that amount in reserve, so we would be able to release it into the in-year position. So it's those kind of things, but we will do a full list of any that we use at year end.
Thanks, Debbie. Councillor Fenton.
Thanks, Chair. Just in terms of pressures in in the coming year, I know the report talks about the long-awaited green paper on funding for adult social care. I just wanted to check that. I presume our assumption is that as and when that appears, it won't have any material impact on the financial position in the next financial year.
Yeah, I doubt it would in the next financial year. I think, I mean, the government mentions it every time, didn't they? And I think in the budget last week, I think it is imminent, although I'm aware that I say that a lot as well. It's coming. It will be a green paper, so it'll be consultative. It'll be setting out a broad, approach. Though it won't be a done deal, so it would be at least a year before anything was implemented, and then there'll be a period of all sorts of other issues. So yeah, I can't imagine that there would be an impact of that in next financial year.
Thanks, Debbie. Just again looking for blue hands, but in lieu of them, I've got another question that I just wanted to put to Ian. So page 35, paragraph 15, which is talking about universal credit and the really quite significant rise in the number of claimants of universal credit to November 2020. I wondered, and I guess I know what the answer to the first part of this question is. Is that a sort of a steady rise over the course of a year, or is that been a sort of a increasing amount of claimants as we've progressed through the year? And as I say, my suggestion would be that probably is what it is. And if that is the trend, do we have any sense at the moment of where things are continuing to move to? I appreciate that we're up to November 2020, so that's relatively up-to-date figures, but there's another sort of 3 months thereabouts coming on. Is it something that is building and building and building, or is it? Do you have a sense of it starting to level off at all around about this kind of figure?
With my crystal ball, it's sometimes quite tricky to tell this. But to answer your first question, has it been a constant increase? Not as much, actually. I think we saw quite a large increase at the start post-COVID, and then that's kind of flattened off around about the period that you're seeing in the report here. So around about the October, November, December period, where actually it might have been a surprise to some people, but actually the number of universal claimants during that period hadn't really increased month to month. The data for this indicator is relatively recent, actually. I think we might even have some data for February at the moment, which is very, very provisional. But we have seen an increase in the data in January. Not significant, but that gradual rise you described there. So we've had a pattern of increase at the start, flattening off, and then increase in the last month. So which way it will go, I'm not too sure. As an authority, we're trying to make sure that the universal credit and the claimants data for the city is available almost in lifetime when it comes out. So we've been putting information out on the open data platform about the information at award level and a demographic level as well, so that we can keep an eye on those patterns. So I can make sure the committee know when that's the next set will be released at a York level if need be.
Thanks. Yeah, I must say the ward level data is really, really helpful, and certainly been looking at Micklegate Ward, and some of the breakdowns that you're providing is fantastic, and quite marked as to different demographics that are being impacted by this, it seems. The one thing that I did wonder about, though, within this data, and again, I don't know whether you record this level of data within it. My understanding from people that I know who work in the job centre is that there has been a general move to transfer people onto universal credit from all other types of claims that they've historically made, and so that's an ongoing piece of work, and I wasn't sure whether any of the rise in the overall figures is due to people who perhaps were previously claiming different things now being categorized as universal credit. Do you control for that at all, or do you have any sense of what that might look like?
Do we control for it? No, but I think you're absolutely right to point out that there are people moving across from other types of claimant schemes onto universal credit. And so it can be quite challenging, actually, to see what is an actual rise on the ground and what is almost a classification issue, okay, in terms of data anyway, not in terms of policy. I guess in order to answer the question as best as I can, we do, alongside universal credit data, publish the other claimant data, JSA information and others, in order for us to be able to track that change. But yes, partially some of that rise will be people moving across to the main scheme. We're expected for people to continue to move across without COVID or any changes on economics for about another 12 months or so. So having that absolute benchmark or line to work from will continue to be challenging.
Thank you very much, Ian. I'm not seeing any further questions, and whilst I do have one or two, because it's to my mind an absolutely fascinating report with all kinds of really useful data, I think I'll save my questions that I can put to you privately rather than make everybody listen to me. So just a last call for any more hands to go up. I'm not seeing any. In which case, I will just say thank you very much indeed, Debbie and Ian. As I say, loads of useful information in there. Yeah, much appreciated. You're very free to leave the virtual table now, and we will move us on to the next item.
Thanks, Chair.
Thank you. So next item, agenda item 5, is the COVID-19 update and preliminary roadmap to council recovery post-lockdown. Now, necessarily, we had to leave this item slightly loose. Councillor Fenton and I had a discussion about how we might request information because we didn't know at the time when the agenda was set what the government's roadmap to recovery would look like, and obviously we knew that the budget was coming up in between as well. So what we're going to do now is receive a presentation first from Fiona Phillips. So Fiona, if you'd like to join us on screen. Fiona is the Assistant Director of Public Health, and then we're also joined by Neil Ferris, who's the Corporate Director for Economy in Place, who also has a presentation, and he's drawn the short straw in a way of trying to mind read the committee in terms of what we want to look at. I did put out email to all members of the committee to ask for a steer on the sorts of things we wanted to look, and have sent Neil a sort of compiled list of the sorts of things we'd like him to touch on. But I think the way I'd like to manage this section is I'll ask Fiona first of all to give her presentation, and then we'll take some questions on that presentation. Depending on how we're getting on, I'll either then just call a quick adjournment or go straight into the presentation from Neil. But Neil's available to answer questions, because I think these two items, we've pushed them into one because they kind of all relate to each other. So over to you, Fiona.
Thank you. Yeah, so I've got some slides just on the epidemiology, if I can be enabled to share my screen. Okay, so hopefully these should come up to you soon. So the first slide is something I'm sure you're all familiar with seeing now. So this is just our sort of epidemiological curve. Sorry, I moved on a bit quick. So as you can see from that, cases have been coming down within York and well below the England and regional average. Just to focus in a little bit more on what's been happening more recently. So this is a data from the start of January, which shows cases on a daily basis. And what you can really see is at the start of January, around about the 4th, that was obviously when we had our peak. And since then, which was when we went into lockdown, those cases have been going down steadily. And where we are now is that we're getting roughly anywhere sort of between 10 to 15 cases on a daily basis across York. And what that means for our 7-day rate per 100,000 is that at the moment it stands at 49.9. What people who follow the data quite closely will see is that that rate, it's fluctuated a bit. So it was steadily coming down, and then it might sort of bump up a little bit and then come back down again. And people often ask me, you know, why is it? Why are we seeing it going up? And I think one of the things I was just trying to emphasize, so when we had a peak of cases on the 4th, what you see is kind of every 7 days from that peak, you get another peak, because the incubation period for the virus is on average around 7 days. So if you have a spike in cases, you see that repeat over that 7-day cycle. As we've kind of gone into the start of February, obviously that peak gets smaller as the numbers diminish, but you still do kind of see that little slight bump up where you had a rise in infections, and that kind of continues on for quite a period of time. So that's why as the numbers get lower, we do sort of see that 7-day rate bob up and down a little bit. But as the first graph showed, the general trend has been down. Just in terms of what we see across the different age groups within York, so that trend, that downward trend, has been the case across all of the age ranges. The one that we are particularly careful to monitor is the 65 plus age group, so those older age groups, and what we're seeing in there. So you can see from this graph that those rates have been going down across all of the age groups. Just in terms of what's happening in our hospital at the moment, so similarly we saw a peak which was around the start of January that commenced, but obviously where you get high infection rates, it takes a week or two before you then kind of see that playing out in terms of what's happening in the hospital. So that kind of started to happen at the start of January, but continued even when we saw case rates falling. The hospital admissions were still high, but they are coming down now, and at a more kind of consistent level as to how we were before the Christmas period. So that's positive, but obviously, you know, the hospital is still under pressure. This is what's shown in terms of COVID patients in the hospital, but obviously, as you'd appreciate, winter is generally a time of high demand for the hospital anyway, so this is on top of the usual high demand. So they're still experiencing high capacity issues within the hospital. Just wanted to look at the death data. So along the bottom there in red, you've got deaths due to COVID. So we did see a spike at the start of the year. The black line is what we'd normally expect to see at this time of year. And then that red line above that shows excess deaths in this period. So we can see that we did have a spike in deaths, which was over and above what we would normally expect at this time of year. And that appears to, by and large, be related to additional COVID deaths. They have started to come down now, and we seem to be a bit more back on track with what we'd expect at this time of year. I just wanted to talk a little bit about lateral flow testing. There's been quite a lot of activity on lateral flow tests, particularly recently, but this is data from the start of February. We've been doing lateral flow testing since before Christmas. This is from the start of February. It shows the data across the 3 testing sites that we have within York at the 2 universities, but also more recently at the start of February, on the 8th, we opened another site at the stadium leisure complex. So you can see there the numbers of tests that we've been doing at each of those sites over the period of a week, and demand has stayed relatively consistent across those sites. Just wanted to point out in the last week from the 1st to the 8th of March, in addition to what we've done at those lateral flow tests, obviously there's been a large testing programme in preparation for children returning to school this week. And I think what's important to point out is that a lot of areas across the country started their testing today. As children return to school, but what we very much wanted to do was to get on the front foot with this. We started it last week so that we could identify any positive cases before the children were on the school bus or back in a classroom, so that we could make sure the necessary isolation was in place for anyone who was positive. So in the 1st to the 8th of March, and in addition to those numbers on the bar charts, we also tested across our 3 sites almost 3,500 tests on pupils, and also in the schools they've done over 8,000 tests in the school setting. So what we had across York was a bit of a mixed model. Some schools wanted to do the testing on site, and others wanted to direct their families into the community stadium. So we worked in partnership with the schools to make sure there was a mixed offer depending on what worked for the schools across the city. Just want to talk a little bit about vaccination. So this is the picture in terms of those who've had first doses in England, and then also in York. So what we can see is just over 32% of our population in York have had a first dose of the COVID vaccine. And then underneath that's broken down in terms of the proportion of over 80s, and then in each of the other age groups there. So what that's showing us is that in those age groups we've had a good high uptake of the vaccine, and also a good uptake within the care home sector as well. Currently, our colleagues in the NHS are delivering the vaccine to the priority groups of the 65 plus, and also to those within the 16 plus age group and above who have underlying health conditions, who've been invited to have a vaccine by their GP practice. So that programme continues to roll out and has high uptake across York. So I just wanted to then just briefly talk about what that means then in terms of our outbreak management, and how coming out of lockdown now is perhaps a little bit different to what the position that we've been in before. So obviously testing, we still have access to our PCR tests, which is the test that we generally use for people that have symptoms, so the Poppleton Bar and the Wentworth Way sites, and that access will continue. But what we also have now that we didn't really have in the same way when we've come out of lockdowns before is much more access to lateral flow devices. So I've talked about our 3 sites across York. Obviously, once children are sort of settled back in school, and either the school or our sites have done that initial testing, children will then be, if the parents wish, will be given access to be able to do 2 tests a week at home. As well as the children at secondary schools, their families can now access lateral flow testing as well, and they can do that by collecting test kits from the Wentworth Way or the Poppleton Bar site, and they can go online and find out the times that they can do that. So, and then what we expect is that what they call the community collect model, we expect that by the end of March, that offer will not just be for families who have children in school, but that will roll out to a much wider part of our population as well. So with a view to moving towards anybody who wants to access lateral flow testing will be able to. That's where we're kind of looking to move to with that. So that's very different to what we've had previously. And what that means is that you can identify people really early before they have symptoms, and make sure that that public health advice to isolate is followed and the contact tracing is done. So that means that we're more able to keep on top of potential outbreaks and stop them at an early stage. The other thing to mention is obviously we've been doing contact tracing. There's the national contact tracing, and then if they are unable to contact people, we then take that on at a local level to do more of the sort of on the ground work to get in touch with those people and make sure that their contacts are identified and advised to isolate. We've been given the go-ahead today, and this will hopefully happen by Wednesday of this week, to do all of the follow-up of all cases in York at a local level. So we see that as really beneficial in terms of being able to get in touch with people quickly, and also to get more of the intelligence about where people have been in the days before testing positive for COVID, so that we can follow up locally with either venues or geographical areas or population groups where we're picking up that we're seeing kind of commonalities in terms of where people are getting the virus, and doing more of that work at a local level with in those areas to kind of look at what's happening and put in place public health measures. Obviously, the vaccine programme rolling out, that means coming out of lockdown is a lot different. So one of the things that we are looking at and need to consider is, obviously, when we talk about numbers of people with the virus, this starts to have a sort of slightly different meaning, because what we know is that with a vaccinated population, although you can still get people who test positive with COVID, the illness seems to be much more mild if they have been vaccinated. So having a case rate of 50 per 100,000, if that's in a partially vaccinated population, is is less of a worry than if you've got that rate in a completely unvaccinated population. So one of the things we'll be doing is looking at what other data we have to actually measure what the case rate means in terms of people who are ill and needing our NHS services around COVID. And then just the other bit to mention, so those first three are all really positive things that make it different. Just the other sort of slight caution to that that we've not really had in the past is around the new variants. So as we've seen, we've had the Kent variant, and what we know in York at the minute, of all the cases that we have that are analysed in the labs that can do the full typing, 100% of those are related to the Kent variant. So we know that we've got a high amount of that variant within York, which is much more transmissible. But also, even if we've got a high number of cases in a population who aren't going to become significantly unwell with COVID, when you get those kind of high transmission rates, what that does enable a virus to do is to start developing mutations. So although we may be able to say, you know, we've got rates that are going up, but people aren't sick, we do have to sort of keep an eye on that. We don't want to allow the virus that opportunity to mutate. So that's just something we need to keep at the back of our minds there. So that's all of my slides, but happy to take any questions on things people want to particularly ask about.
Thanks very much, Fiona. That was really, really helpful. So I'll just hand over to committee members for questions, and Councillor Kilbane has beaten Councillor Fenton in the race to get his hand up first. So Councillor Kilbane, over to you.
I'm very happy for Councillor Fenton to go first if it's more pressing. I'll fire away. Thank you, Fiona. Thanks for that report. I thought you missed a glorious opportunity, though, to say that 102% of 75 to 79-year-olds have had their vaccination in York. That would be quite a stat to claim. I fully understand why, you know, it's based on an estimate, but yeah, that'd be a great headline. Just in terms of the ratio of admissions to hospital beds as opposed to the ITU beds, the ratio seems to be much larger now in terms of, you know, it's a lot better now than it was a year ago. It's quite close a year ago, but now we have a big spike in hospital admissions that doesn't result in the same sort of number or proportionate number of people going into the ITU beds. Do we know why that is?
Yeah, so there is something about the treatments being better. So people treated on the wards without needing to have to go into ITU. So that has improved since last year. Also, kind of things that are being done within the community. So our primary care colleagues have made the offer to people who are being diagnosed who are unwell to have pulse oximeters, which they can use at home. So if they see that their oxygen levels are deteriorating, they see that early. So again, that enables that kind of early treatment so that you're potentially less likely to have to end up in ITU. So that's contributed to that in many ways.
Thank you. Councillor Fenton.
Thank you, Chair. Thank you, Fiona. In terms of you mentioned the sort of Kent variant being dominant now. To what extent does that sort of help to explain where there is a sort of spike in a particular area? That does that, to what extent does that explain its the fast spread of a virus? I know there's in one part of my ward, which is split with another ward, I was sort of monitoring the sort of color-coded map, which is really quite interesting to sort of keep an eye on, and it went from white to blue, so there's quite a quick change. So are we seeing any trend in terms of sort of, you know, source of spread of the virus, or is it just a case of its community transmission, and it just because of the nature of the variant, it spreads more quickly?
Yeah, I think it's more the latter. So what we see now is, you know, previously if we had in any setting, in a workplace, in a school, where you might get one case, you could previously kind of isolate that person and you potentially wouldn't see any other cases in that setting. what we often see now is that when you do get that one case, you'll then generally get, you know, some more cases, just because it is much more transmissible. So most of the cases that we're seeing now, we have 2 care homes who currently have cases. Most of those are picked up on because they do routine testing in the care homes. So when we get those cases in care homes, often it's in staff and they're asymptomatic. An example in terms of the vaccine, so we have 1 care home at the moment that has cases within residents, and they're all residents who are vaccinated and generally not unwell with it. So that does make a difference. But yeah, most of the other cases we have are in households, so it'll be sort of 2 or 3 cases within a house. So once somebody in the house gets it, it's very hard to stop it spreading to other people who live in that household, just because it is so transmissible now.
Thanks, Fiona. I'm just going to jump in ahead of Councillor Mason, just because it's supplementary to that, because I think he's probably referring to the same blob of the map that I was looking at, because it's our wards that border each other. And it crossed my mind, and I'm not sure what the positives and negatives of this might be, but because when I looked at the numbers, I think we'd had something like an 800% increase in number of infections, but it had gone from sort of 2 or 3 to 14 or 15, or, you know, so the actual overall numbers were so small as to be completely possible to be a single outbreak, although, you know, notwithstanding some of what you've just said. But what it did cause was 2 or 3 people coming to me, and possibly Councillor Fenton had the same, of people kind of worrying and saying, oh, you know, our area has suddenly gone really high again, what's going on? And I just wondered if there would be any benefit to possibly being able to flag on the data when it comes out, not obviously with anything identifying where an outbreak is, but if we do know that, say, there are 10 cases out of 15 that are associated with a single place, and that's what's driving a big spike in the data, while ever the numbers are as low as this, is there a benefit to saying, yes, there's a 600% increase, but actually it relates to a single outbreak, rather than the population more widely kind of worrying that suddenly it's all rising again and their efforts have been in vain, sort of thing?
Yeah, I mean, it's something we can certainly look at. Yeah, it does sometimes get a bit tricky, just because, like you say, we try not to identify certain locations, and so more often than not, like you say, there's not usually one outbreak that will account for all cases in an area. So we might know, you know, so for example, some of the wards that have high rates, over a period of a week, that might be 20 cases, and, you know, 12 of them might be located at one outbreak that we know about, and then you get a spattering of the other 8 that are sort of just within households here and there. So it's just looking at how you communicate that without identifying a particular premise, and then, you know, without sort of worrying people about where that might be. So it's certainly something we might look at, or can look at, and maybe what we might be able to do is to sort of think about how we better communicate what the numbers are, so that people don't get worried about the rates, because I think sometimes the rates look more alarming than the actual numbers.
Yeah, thank you. I think that's probably exactly it. The actual numbers can be very, very low, but the rates can appear much higher. Certainly the amount they've risen by. Sorry, Councillor Mason, I jumped in there, but over to you with your question.
Thank you. And you probably guessed the theme of my question, Fiona, but you know, my experience of the testing program in schools, you know, the staff and teachers and everything, it's been fantastic and successful, but obviously there's been challenges from my experience around stock, and particularly things like home test kits for staff not having sufficient quantities as we would have needed, and things. And I just wondered, what does that look like across the city or nationally, if you've got any, you know, any observations on that? Because actually, you know, now we might be fine, but, you know, long term that might affect the city in terms of making sure those stocks kind of keep flowing through.
Yeah, it was something I was quite keen to ask our colleagues in DHSC when, you know, when they announced all these various different modes of people being able to get lateral flow tests, of, you know, are we going to, run out of them? So I've been assured by DHSC that there aren't going to be any supply issues, that there are plenty of tests and they will start to filter through. Obviously, with the secondary school pupil testing, it's the boxes or the kits that children will be sent home with from next week. They've not arrived yet, so I'm still keen to make sure that schools do get those deliveries ready for next week. So we've not been told that there are any issues with that, but I'm yet to see them arrive in our schools, so definitely be following that up. Obviously, I think we are in a better position than some areas in York, because if for any reason those kits don't arrive, we've got 3 community venues where we could do testing for school pupils, so we have got that bit of a backup. But yeah, I've not been told that there will be any issues with supply of those.
Thank you.
Thanks, Fiona. I'm not seeing any further blue hands. I've just got one further question, and then I think what I'll do is just take us to a short adjournment before we move on to the presentation from Neil. And in a way, the question I'm going to ask you, Fiona, possibly Neil might end up covering a little bit of as well. It was just about, as things open up again and as we start to hopefully welcome more visitors into the city, from a public health perspective, do you have any concerns about that potentially driving an increase in infections? Or I know certainly before Christmas there were some concerns about people travelling in from areas of higher infection and possibly bringing driving the rate in York at all. I don't know what thoughts been given from the public health perspective as to how we address that, how we mitigate that. So just welcome your thoughts, really.
Yeah, so I mean, I think we're certainly I think it's going to be a better position than before without having the tiered system. So we're not going to be in that situation where we potentially have lower rates and then appear more attractive and getting people travelling in from other tiered areas. So I think that creates a much more even playing field. Obviously, York is an attractive place and a tourist destination. People from other areas who may have higher prevalence, will inevitably want to come to York. And I think what we're trying to do is to just make sure that we've got all that messaging and the environment in place so that people can follow the guidelines. So, and I think some of the reopening is about taking it slowly and as each step comes. So for example, the first bits of lockdown will start to enable more mixing, but only in an outdoor setting and still limiting the number of people that you're mixing with. And we know that kind of mixing outside is much less risky than indoor mixing. And then, as bits of the economy open and we move more to things happening inside venues, it's about getting that messaging out there so that people are still following all the other advice around hand washing, making sure that our businesses, have got that environment so that people can follow the advice, so that there is facilities to wash hands, and so that measures to kind of enable social distancing when that still has to happen, the kind of environment is right so that people can easily do that. I think it will be challenging. I think there are, I think what we found before is that residents do get a bit nervous when they see a lot of people in York city centre, so we need to manage that and be mindful of people's nervousness around that. I think particularly, if we've got a lot of people who haven't ventured out much, recently, and so suddenly finding yourself in a situation where you're surrounded by a lot of people can feel a bit unusual. We've kind of got a bit into the habit of not being in crowds, and so people may find that difficult. So I think anything that we can do to just reassure people around the safety measures that we've got in place, and that we're taking this in a sort of very measured, slow way. Obviously, all of that roadmap that the government have announced, each of the next stages is dependent on what the data is showing us. So those kind of 4 measures that we have to pass before we move on to the next step. So I think it's about, you know, just being led by that data and seeing what's happening, and ensuring that we're at that point where we can move to the next stage, and doing it slowly and measured, and all of that comms reassurance to people, and following that public health guidance will be key.
Thanks, Fiona. That's really helpful, and I think that will move us neatly into Neil's section. So what I'd like to do is, Fiona, if you can stick around for the next part of the meeting as well, because I think it'd be helpful just to have you on hand if needed. I make it 34 minutes past 6. So what I propose we do is we just take a short adjournment now, with a view to coming back at 20 to 7. So just a 5-minute break, and then we'll come back. We'll receive Neil's presentation, and then there'll be some questions for Neil, no doubt, as well. So if you could just follow the on-screen instructions, and we'll see you shortly. Welcome back, everyone, to this evening's meeting of the Customer and Corporate Services and Scrutiny Management Committee. We are partway through agenda item 5, which is the COVID-19 update and preliminary roadmap to council recovery post-lockdown. Snappily titled agenda item, as always. So we've done the discussion, or not finished, but we've had a great update from Fiona Phillips, who's Assistant Director of Public Health. We've also got Neil Ferris as the Corporate Director of Economy and Place on the screen, and I think Neil has a presentation for us based on some of the questions that some members had put forward for him to address. And then obviously we'll hand over to members to ask any questions and anything that they want to draw out. So over to you, Neil. And Neil, I'm just waiting for you to unmute yourself.
There you go. Sorry, just trying
Thank you.
The unmute moves about when you go onto screen sharing. So what I'll do is just do a quick headline of unlocking the city, and then obviously we can move on to the questions that you've posed through the group, so I can do those straight afterwards as well.
That's great. Thank you.
Okay, so just wanted to remind everybody of the phased return that we're looking at, the roadmap. And as Fiona said, it's a slow approach, it's a cautious approach, it's an evidence-based approach. So it's in 4 steps. We're obviously looking at the rule of 6 coming back into play on the 29th. As of today, you can go outdoors and meet one other person. You move to the 12th of April, seated pub beer gardens open, all shops reopen and self-catering reopen. We're still seeking clarification from MHCLG in respect of off sales of alcohol, whether or not that's going to be reinstated on the 12th of April as well. Your members will remember last year the licensing regulations were changed on a blanket basis across the whole UK, so off sales were allowed. The Prime Minister's spokesman over the weekend confirmed that they would be available, but we've not had anything in writing from the ministry as yet on that. 17th of May, pubs reopen, rule of 6 indoors, and then we move to the 21st of June for reopening. So in terms of the city, York is already much busier than it was prior to in the previous lockdown. A lot more activity going on, particularly across trades and construction within the city. And as Fiona's highlighted, there's going to be a significant increase in people as we progress through the phased return. And that is based on a background where we've got a city that's able to cope with 7 million visitors a year, and it's been principally enjoyed for the last 9 months by 200,000 residents. So it's going to, not only is it going to be a shock to get back to normal levels, if we do have what some are calling a COVID bounce with effectively a big increase in staycations and hospitality in the UK, that will even feel more of a change for residents of the city. So the clear focus that we're pushing forward with is a focus that is creating safe, well-managed city centre spaces and ensuring that local businesses can reopen. We've been speaking with a lot of local businesses over the last few weeks, and they're very much behind the message that York is going to be a safe place to reopen, because the challenge will not be about attracting people to the city, it'll be managing the quantity of people who want to come to the city. Outdoor seating spaces will therefore be crucial, particularly as we move to stage 4. So what are we doing about the outdoor spaces? We're going to effectively look at third-party managed spaces. So like last summer, Dean's Garden, museum gardens, making sure that they're open, accessible and clearly signposted across the city. Again, that idea of attract and spread across the city centre. Trader-led streets, so where we've got adjacent businesses who want to undertake a cafe license activity and they want to expand beyond what they would normally do, we would facilitate that, particularly in areas such as Castlegate, Fossgate and Micklegate. Members will remember that last year we approached the Micklegate traders on a number of occasions, but they didn't wish to participate in a trader-led street, but that is something that we really will be looking to encourage where we're able to do so. trader-led squares, so King Square, St Samson Square, St Helens Square, again, big spaces in the city bordered by hospitality. But we're also very conscious that there are spaces, there are those hospitality hospitality businesses within the city that don't have immediate adjacent space. And we're working with the bid and using our own funds to look at coordinated spaces such as College Green, Parliament Street and Shambles Market. And unlike last summer, what we're looking at doing is doing more of that, but with adjacent businesses, so that they take responsibility for the management of those spaces. And then there's the more general spaces such as the Riverside and Tower Gardens. Again, we're very conscious of the what did I phrase it this morning? Unbecoming behaviour that sometimes took place in those spaces. So community safety, neighbourhood policing teams very much working with the COVID marshals as plans for those areas as we reopen this city to make sure, one, we get appropriate behaviours, but also social distancing occurring in those areas. That's the spaces. Pretty much following last summer's approach, but more of it where we're able to do so. The COVID marshals, we're making recommendations to executive that they're extended to the 21st of June. We're considering the additional provision of public toilets and bins, particularly, as I've said, in those areas where we encountered issues last year. And then the recovery grant, there's 200,000 being allocated in that by Councillor Ayres' decision prior to Christmas to enable businesses to reopen in the city in terms of general support. And we're looking to allocate that 200,000 towards the type of activity that I've highlighted in the presentation. And that's a quick, brief presentation about the city's reopening.
Thanks very much for that, Neil, and I appreciate in some respects it was a very large area to ask you to cover. So that's a really good starting point for us to jump off from. Thank you. Councillor Musson.
Thanks, Chair, and thanks, Neil, for that. I wondered if you could speak a little bit about, with regards to what you talk about with opening up places and restaurants onto the streets and anything that's related to those kinds of changes, what kind of consultation that you have done in the run up to maybe making these changes or are hoping to do between now and then with particularly blue badge holders and disabled organisations in York, just because it would be good to know that we've sort of learned from our mistakes in making changes like that without considering the impacts that they have on everyone.
Yeah, well, in terms of the principal area of foot streets and the cafe licences, those traffic regulations orders remain in place. And that's the executive has determined that will be extended through till next September. So the spaces and the consultation that we undertook last year with the disabled communities, that all still stands. Now, obviously, executive are considering making those foot streets permanent, or some of those foot streets permanent, and that consultation, the launch of that consultation is due to go to the executive member for transport, I believe in April, and that will then lead to a decision in September. So the principal area we're looking at is those foot streets. I'll just highlight to members, but you may not be aware, we've only just been notified over the weekend that the government are extending those cafe licences for another 12 months. So that will extend from September this year through to September 22 under the same regulatory regime. So no planning permissions required, the same as last year. And that's where we are on the cafe licenses.
Thanks, Neil. Just supplementary to that, have any conversations been had? You mentioned about the Micklegate traders, and I think you mentioned Fossgate and one or two others. I'm just wondering about some of the secondary shopping areas in the city, particularly sort of like Acomb Front Street. I know Chewith has a row of shops. I think Haxby's got a similar row of shops. Are there any conversations going on about doing similar style opening up of areas with some of those sort of shopping areas that are outside of the city centre?
Yeah, Councillor Waller's got and officers are hosting a traders association meeting in about, I think it's 2 weeks' time, effectively to have that dialogue as to what we can do to support the traders, the secondary shopping centres across the whole of the city. Now, as to whether or not that there's the ability to undertake any road closures or in those areas, there obviously they'll be each subject to individual cases, but certainly cafe licences across the city is something that's going to be encouraged by us and central government as a way of effectively spreading customers.
Thank you. Councillor Mason.
Thanks, and maybe a little bit similar to that. You know, obviously not just in the city centre, but people spread out all along the river, all the way up to Clifton, all the way down to you know, the Millennium Bridge, onto the Knaresmire. And obviously those areas probably suffer from similar issues than you would if you were in you know, the gardens and around Clifford's Tower, access to toilets and things like that. You know, I remember, I think myself, dashing from Millennium Bridge to Roundtree's Park hoping it was open, and I just wondered what we can do outside of just the kind of core city to look at other places. I mean, even in our ward, you know, Woodthorpe Green and places like that.
I think we just got to reflect that the city is geared up and does successfully deal with 7 million plus visitors a year. So whilst well, like I said earlier, it will feel very strange to have the sheer quantity of people back in the city. Our facilities are comprehensive enough to deal with that level of activity. And whilst we are spacing them out, they generally, well, they will always be associated with a premise of a trader. That's where you'll be getting your food, your alcohol, your refreshments from. So it's the hospitality sector in terms of the provision of particularly toilets will remain the same as it does in normal times, but we will be looking at potentially additional toilet facilities, in particular in the city centre, like we did last summer.
Yeah, I'm not sure that is always right. I think there's a much more culture now of me meeting some friends and having a bottle of wine by, you know, the Millennium Bridge instead of thinking about going into a city centre venue. I think lockdown has changed some of people's kind of socialising habits and maybe not always linked to a specific venue. And I think that's probably when those challenges probably come. And Councillor Crawshaw know things like the races. You know, it's those transient, you know, moving between places and not specifically where it's always linked to a venue.
But yeah, I mean, we're not going to be providing significantly new venues, but potentially in terms of should we say, supervising people's behaviours so that they are able to take account of appropriate facilities. That's where we've got the COVID marshals, the neighbourhood policing model, etc., to ensure that the city is respected by our visitors.
Thank you. Councillor Rowley.
Oops, you're on mute, Councillor Rowley.
Sorry, thank you, Chair, and thank you, Neil, for that presentation. I have a number of questions, but I guess I'll try and keep it brief. You've kind of partly answered one of my questions, which was for how long will we have this kind of cafe culture, and is there a sense of permanency about it, and with the announcement that the licenses are going to be extended until September 2022, that I guess that's about as permanent as it's possibly going to be in terms of, you know, what we can do. My other question really obviously is we return to some sense of normality on the 21st of June. And we are aware that the Chancellor in his budget last week for retail and hospitality essentially gave a commitment that business rates wouldn't be required from those qualifying businesses until June this year. As well, you know, Neil, rates are assessed on square footage and square meterage. How will these cafe, these new kind of cafe licenses, how will they be assessed for business rates? If somebody spilling out onto a particular pathway or a particular square area, how will they be assessed for business rates? And if they're not, how can that be fair to those that are being assessed for business rates and have to pay them?
Okay, so very good question. I point out that in terms of permanence, the executive are considering making the Foot Street extensions permanent. So the ability for businesses to maintain a cafe culture on a long-term basis will be facilitated. But in terms of the cost of undertaking that commercial activity in the public realm. So the cafe licenses, it will only be for the next year that the fixed fee on a national basis of £100 would apply. You then, as a local authority, have the opportunity to put in place fees and charges for cafe licenses across the city. And previously, from recollection, some of those fees could be £700–800 per license. So it will be a matter for yourselves then to start to look at how you wish to effectively account for the fact that the public can no longer use that space when it's being used commercially.
Thank you. Did you have a second question or a supplementary?
Well, it was more to do with the business rate question, Neil.
So the business rates will not be taken into account in terms of the cafe licenses. The charge for the use of the commercial space is under a cafe license fee. There is no, it isn't a business premise, it's public realm, it's highway, which is why you apply for the license from the Highways Authority.
Thank you, Neil. Councillor Fenton.
Thank you, Chair. Thank you, Neil. I'm just thinking ahead to sort of the enforcement picture. You've mentioned neighbourhood policing and COVID marshals. Obviously, we're told that this period of coming out of lockdown will be different to the previous time in that there won't be tiers, so we won't have the issue of people coming from tier whatever into York, which at that time was in the lower tier. So what do you think that the kind of landscape of enforcement will be in terms of police taking the lead, council, public protection officers taking the lead, COVID marshals? Have discussions begun amongst all of those players? Because I think certainly there is confusion as to where responsibility sits for enforcing different bits of the sort of the sort of framework of guidance and legislation. So have those discussions started in terms of who will enforce what, when, and where?
Those discussions have started. I mean, I'd be interested in members' views as to the extent that you want additional enforcement or additional guidance in terms of additional COVID marshals, and it's a perspective that the authority can take as to how many people it puts out on the ground. But I just would note that from the 21st of June, the expectation is that the legislative arrangements around COVID restrictions on our behaviours will fall away. So there will be no enforcement to be undertaken if those regulations fall away from us as individual citizens.
I don't know if Councillor Fenton had any further comment. I suppose my thought, for what it's worth, is that it's about getting the balance right, isn't it, between now and assuming that we stick to that timeline of June the 21st of just making sure that people are confident to come into the city centre, and that people who are regular users or local residents are not put off from coming into the city centre in the first few weeks, and therefore their behaviour is never return, because I think at the moment there's a lot of people who probably haven't been into the city centre for the best part of a year, and it's how do you get those people to feel comfortable coming back into the city centre ahead of the hopefully large crowds of people in a very, very safe environment post the 21st of June or whenever it is that the restrictions go.
I could reassure yourself, Councillor Crawshaw and Councillor Fenton, that all the businesses that Matt Boxall and his team are talking to are very clear that that's the sense of security that they need to convey. But we all know that when the city has a fantastic weather on a bank holiday or August bank holiday, that it's busy.
Councillor Kilbane.
Thank you, Chair, and thank you, Neil. And just in relation to Councillor Fenton's question, I think there will be tears after the 21st of June, and it'll be tears of joy as we can all meet each other again and give each other a hug and socialise. God, I can't wait. Okay, sorry, back to my question. I'm glad to hear that Councillor Waller is meeting with traders associations, but I must declare an interest as the ex-chair of Bishopthorpe Road Traders Association, so I'll duck that one. And just in terms of the the traders' squares, which sounds like a really interesting idea. What can the traders around those squares expect in terms of assistance from the council, trying to make it as easy as possible for them to open up in the public realm outside their businesses?
Well, similar question. Well, exactly the same support that we gave them last year in terms of the really proactive approach to effectively issue cafe licenses where they're applied for. But we've obviously got to reflect the safety of the highway user as well. So when it comes to building things that obstruct views and visibility, we would obviously need to be very careful about the nature of the interventions that those businesses want to make, because obviously we've got broader responsibilities beyond those businesses. But very much they can expect a proactive approach to applications for cafe licenses within those squares and the space that they're proposed to take up.
It's just asked the question because I'm aware of a business that's been trying to get outside seating for 6 months, and time again it meets obstacles again when it's dealing with the council, and it's finding the process very, very difficult. So it just makes me think, how are the traders going to be enabled to use those squares rather than finding obstacles that prevent them from doing it?
In terms of where there are obstacles, it's because we're balancing the risks so that we as a council have to manage. So I'm aware of traders that have made applications for cafe licenses that would cause residents and visitors to step out into the highway. That's clearly something we cannot accept as a highways authority. So when I say we're there to facilitate, we absolutely are there to facilitate, but we also will protect.
Sorry, Neil, my question's about the squares rather than the highway.
Yeah, well, in terms of the squares, if you've got a specific case you wish to refer to me as a problem that's on a square rather than a highway, because it's the highway ones I am aware of, but I'm not aware of issues in particular of any square trader against a square that's got an issue. If you've got a specific case, let's have a conversation offline.
I think, well, I'm just thinking, in general, what are we going to do to get people out there using the space?
As we say, enliven it with the businesses who operate in those squares. I mean, there was very much a demand for those squares last year by traders, particularly the hospitality traders around those squares. Very much a huge demand for those licenses. Now, the question you've raised is one that there's a trader that's had specific difficulties, so I can look into that. But we did have those squares occupied by hospitality trades last year, so, and I expect the same this summer.
Thanks, Neil. I'm just looking for further blue hands. I see Councillor Kilbane's hand is up, I presume, for another question. I'm going to jump in ahead of him in lieu of anybody else, which is just a sort of a question more generally around the opening up of the city centre, but also sort of specifically around West offices as well, because I think there are a number of quite large employers in the city centre that a lot of the smaller employers, and particularly the small cafes and shops, rely on quite a lot for lunchtime trade and that sort of thing. And so I think they're desperately looking to see, when are everyone going to return to West offices? When's Aviva going to reopen again? And obviously the roadmap, it has the sort of things about we're all focusing on the social aspects, as Pete rightly pointed out, desperate to see people and all of that. But do you have a sense yet of, perhaps you may not be able to give us specifics on West offices, but are there conversations with some of those bigger employers about what they're planning to do in terms of opening up? When might some of those smaller shops expect to start seeing regular employees back in the city centre? And if you have got a steer on anything to do with West offices, by all means spill the beans, because I think we're all probably interested to know what might be happening.
Yeah, well, if I I'll address the West offices one straight away. I mean, through the budget process, members agreed an extra 350,000 of revenue from West offices. So it's not a question about necessarily council staff returning to West offices. It's about West offices returning to the intensity of use that it previously did. So it's the number of people in there, not necessarily who their employers are. And I think that's a key piece across the whole city. So what we're seeing with all the big national companies, so Fujitsu, Lloyds, HSBC, others, they're all announcing that they're going to reduce their office requirements. Aviva have now announced that they're not going to reopen their Monks Cross offices. they will not be reoccupied by Aviva, but the city centre offices will be more intensely used. We're hearing from developers in the city that lots of office-based businesses are looking to downside where they've got lease breaks occurring. Now, interestingly, I think that from my perspective on this, and it is just a perspective, but it's one that's informed by discussions with developers, is that York could potentially have a significant advantage here, because larger footplate offices in the likes of Leeds, Birmingham, Manchester, London, etc., are intrinsically more expensive than York. But the reason we were not able to offer them, because of the beautiful sort of historic nature of our city, those big floor plates. Actually, going forward, those companies will not need those huge floor plates. So York will potentially start to form a bit of a niche operator in terms of the office market. So for me, I think what I would suggest, from an economic perspective, we need to intensify the economic activity in the office space we've got and promote more office space in the city, but based on that increased intensity of use. So 2 to 3 days a week in the office would seem to be where sort of the business community is landing in terms of an expectation, and you'll see that in Network Rail and, for example, TPE are starting to change their model for season tickets to allow for that 2 to 3 days a week in the office, but actually that means you've got more workers within a defined office space. So that would be my response to that question.
Thanks, Neil. That's certainly interesting. Councillor Mason, I think you've got supplementary to that.
Yeah, I do, Chair. I suppose it's kind of off the back of yours about our staff going back to West offices. I wonder, Neil, if there's any update on councillors going back to West offices in terms of, I suppose, one in terms of use, but obviously public meetings. I'm aware the legislation is supposed to end at the start of May that covers virtual meetings being legal, and I just wondered if you've got any updates or anything on that.
I'll defer to Jamie. She's on the call on the legality of public meetings.
I'm afraid there's still no update. We're waiting for a decision from government as to what might happen. So we're contingency planning for meetings post 7th of May, but we've still got no details from the government whatsoever.
Thank you.
Yeah, and just remind members more generally that the government have confirmed that working from home will still remain the message until the 21st of June. So in terms of the context for that decision that Jane is waiting for from government, that's the overall advice. I'd also note that a number of businesses, and Councillor Crawshay referred to Aviva, a number of businesses across the city, and particularly nationally as well, have already confirmed that they will not be undertaking business events for this coming year. So they've effectively said 2021 we will not be having significant gatherings of staff together. I think obviously that's also in the context that not all age groups will be vaccinated until the autumn. So there's a general sense that type of, where there's a choice, gathering people together for commercial purposes won't happen.
Thanks, Neil. And I think just building on Councillor Mason's point, just more generally as a committee and as a group of councillors in the city, I do think that we probably need to start thinking about what have been the positives about working remotely and what might a possible hybrid approach give benefits to if that was the way we wanted to go, or do we want to return to entirely physical meetings in West offices? And I don't know whether that's perhaps a role for Scrutiny to actually start thinking about what is and isn't physically possible and what is and isn't desirable, both for us as councillors, but more importantly for residents of the city in terms of their ability to interact with us and see the business of the council happening in an open format. I've got a couple of hands up. I was going to jump to Councillor Mason because Pete's asked a few more questions than you. So Councillor Mason, your hand was up. Was that for something separate, or was that related to what you were just bringing up?
I think I probably just haven't taken it down, but just off what you did just say then, actually, I think that's a really interesting thing for us to look at, is what benefits have been gained. I imagine for councillors that are still in employment, being able to just hop onto a virtual meeting opposed to have to be in a physical place has brought huge benefits. So I think there's lots to talk about in terms of what's worked, not always, but what we can take forward. But I'll take my hand down. That's just something I wanted to say.
Yeah, could I add to that, Councillor Crawshaw?
Sure.
I know it's something close to your heart. Is the climate change impact of not having people travelling as well, and that's residents and the councillors and officers. So just something into the mix.
Yeah, I think that's a good point. So, Councillor Kilbane, I'm going to keep you waiting because Councillor Rowley's stuck his hand up and he's asked fewer questions than you so far. So I shall bring him in first.
Thank you, Chair, and sorry, Councillor Kilbane. You're more entertaining than I am, I have to say. Neil, just on a somber note, we are aware that there will be a number of businesses that will close and probably have closed over the last 12 months. And whilst we hope and pray that we'll have a good summer from a hospitality point of view, and that'll just swell the council's coffers a little bit, what calculations have been made with regards to the lost revenue? Again, I'm coming back to business rate revenue for businesses that have closed. And again, if we are looking at a permanent change in working patterns, again, that's going to affect some businesses that may not close. So what calculations have been made from a budget point of view for lost revenue from those?
So it would have been a more appropriate question for Debbie in terms of precise calculations. So, but I can give you a more general perspective on it. So our own commercial estate in the city is incredibly well occupied, and we've been undertaking relets during lockdown. And today we were talking to another developer in the city, has a number of retail and leisure outlets. Strong interest in New York shop floors, which is really good for us. I think the big shop floor plates are going to be the challenging ones, and we're looking at regeneration opportunities with those, particularly working with developers on Coney Street. The LEP funded us with £50,000 worth of development money towards the end of last year to start to bring forward proposals for a riverside walkway and making Coney Street look two ways with smaller foot plates on the ground floor. So that's a sort of mitigation factor to get our occupancy levels back up to where we were previously, which was the third highest occupancy in the country. So I think there's very strong chance that York will continue to remain ahead of the pack in terms of occupancy levels. But it's certainly in terms of specific calculations, I know there's been some sensitivities undertaken by finance, but what they were precisely, I wouldn't be able to say.
Thank you. So, Councillor Kilbane, it's over to you.
Oh, thanks, Chair. Neil, we're seeing long queues again outside, or we're getting reports of long queues again today outside Hazel Court Tip, blocking access to some of the businesses. If that continues, are there any plans to return to the booking system?
Not at this time, Councillor Kilbane. We're literally 3 months away from, effectively, all being well, those restrictions being removed altogether in terms of our behaviours. We are putting more resources on the site, and as you'll be aware, we've brought forward the winter opening, summer opening hours by 2 weeks. There is a school of thought that the previous booking system actually constrained demand, and what we're seeing now is a consequence of that constrained nature of the booking system. So at this moment in time, there are no plans to reintroduce the booking system, but obviously that's something that's been kept under review with the appropriate executive member.
Councillor Rowley, I'll bring you in for a supplementary, but I'll just give you the bits of feedback I had, Neil, which was actually the opposite of that people found, and this was anecdotal, but I certainly had 2 or 3 people in my ward saying to me, oh, this booking system is so much easier to use, it's much easier to get into the tip, and why won't they bring it back? So I'm not convinced that it constrained demand. I think
it's a school of thought, and obviously if you've got a view, then obviously make representations. You might want to consider that for scrutiny in Councillor Kilbane might want to consider that in economy in place.
Councillor Rowley, I think you were indicating you had a supplementary on that as well.
Thank you, Chair. Neil, it is a supplementary on Councillor Kilbane's question with regards to Hazel Court. As one of the businesses that is affected on James Street, my business really can't be affected in that way. Has any thought been given to the possibility of diverting traffic that comes to the Hazel Court tip and backs up on James Street, to diverting them onto the tip at Strensall?
To Telthorpe, I can look into that, whether or not there's any redirecting being undertaken, but Telthorpe is obviously a much smaller facility. I mean, just so members are clear, part of the reason that we are getting the backlogs at the moment is because of the risk assessments that we've got in place to make sure that we're keeping our citizens and also our operatives safe. As they fall away and become more relaxed in terms of the 21st of June, then obviously the capacity should rebound to normal levels.
Thanks, Neil. I'm starting to just keep an eye on time because we're not got too much longer of the meeting left. But I've got a couple of blue hands up, so I'll take those two questions. If anybody else wants to ask a question as well, if you want to just indicate now, and I will bring you in, because the people waiting are people who have asked questions so far on this section. But I'm not seeing other hands going up. So Councillor Fenton, first of all.
Thank you, Chair. Just something else to throw into the mix for Neil to consider in terms of sort of waste disposal. Obviously, people are being told to sort of stay local wherever possible, and we do have bring banks at a number of locations around the city. And I know with lots of people shopping online, the volume of cardboard that's being generated, waste cardboard, is really quite phenomenal. And I know whenever I put some in the boot and go to Tesco, invariably it comes back with me because they're invariably full. Although sadly on Saturday night one of them was set on fire, so there's now a sort of a charred patch where that was. So again, if that is something that could be considered in terms of both the capacity and the frequency of emptying, again, it's all these things that can hopefully make it less likely that people will feel that they have no option other than to trek across town to James Street.
Yeah, thank you very much for that, Councillor Fenton. I'll
Thank
feed
you.
that into the operatives who are servicing the facilities.
Great, thank you.
And Councillor Kilbane, another question from you.
Last and least, just a quick one, Neil. Have we got any plans formulated to try and encourage people to use public transport as we emerge from the restrictions and people can start coming back into town? What are we doing to try and get them on the buses?
So we've been speaking with First Group, and just today we were speaking this morning with Mr. Micklejohn from TransPennine Express, and they're very excited about reopening public transport, particularly obviously post 21st of June, when they can get back into full capacity. So, because obviously it's the social distancing that's impacting the capacity of public transport. But TransPennine Express have been investing heavily in their new rolling stock, and as you know, as an authority, along with DFT, we've invested in our brand new fleet of electric park and ride vehicles. So both First Group and TransPennine Express, I'll just use those as two operators who service the city, are working with us and are really excited about putting forward their new promotions for public transport as the city reopens. I think one of the things that's been picked up on this call is the changing nature of the commute. So if it is 2 and 3 days a week, then actually 5-day tickets and annual season tickets or monthly season tickets don't work. So they're both coming up with new ticketing regimes that will be X number of journeys rather than physically constrained by a calendar period. So it's quite interesting that they're preparing people to use those forms of transport rather than the car, which you might choose to do so if you're only coming in 2 or 3 days a week.
Thanks, Neil. I think that probably wraps us up for this agenda item. So thank you very much, Neil, for your input there, and thanks again, Fiona, for yours earlier. And apologies, I think I could, in hindsight, have let you go at the adjournment, but it was helpful to know that you were here should something come up. So thank you both very much. You're now very welcome to leave the virtual table, as it were.
Thank you very much, Councillor Crawshaw.
Thank you, Chair.
Thank you.
Bye.
Just before I move us on to the next agenda item, I think it's probably worth us just noting that my sense is that some of the stuff around the city centre reopening and the economy is something that we probably would want Economy in Place Scrutiny Committee to just keep tabs on, and I don't think we need to make a referral as such, given that Councillor Kilbane is the chair of that committee, and so I'm sure we'll do so. I think the other thing that came out of that discussion was the possibility of this committee having a look at the working arrangements for future council meetings, in terms of certainly I think committee meetings and what have you, and what the options might be in terms of possible hybrid meetings and that sort of thing. So I think if everybody's in agreement, I will add that onto our work plan, and just think about how we think about taking that forward. If I can just sort of see that you're all happy that I do that. Looks like everybody is, so that's great. And then that will neatly segue into the next agenda item, which is indeed work plan. So you have in your meeting pack just an outline of the next month. Actually, I think that this ought to have been a little bit longer term than it currently is, because we are starting to try to push out the work plans of the scrutiny committees a little bit further ahead, so that both scrutiny committee members and officers are in a position to be able to plan a little bit more how work by the committees is happening. Just before I go on, actually, I should just note that Councillor Rowley did send me a message to say he needed to leave the meeting in order to go to his parish meeting that he's attending. So that's why he has disappeared from our screen. But yeah, just taking us back to our committee. So next meeting that we have is the 12th of April, where we'll get the public health update. We've kept corporate services update on the agenda as an open item. This was in discussion with Councillor Fenton and myself, just because as things are sort of opening up, and we wanted to have a little bit of flexibility to be able to potentially call in officers depending on what things are in the ether, as it were. So for example, this week we were wondering about whether we might want an update on schools, but actually that all seemed to be fairly straightforward, and looking at the economy opening up seemed to be more sensible. So I think when Councillor Fenton and I next meet, we'll just look at whether that stays on the agenda in that form. And obviously the other things that we've got, we discussed the Medigold re-procurement, which is the day one absence, and Trudy Foster had indicated that the April meeting would be the best time for her to bring that back to us. And another item that we've got hanging on the agenda from pre-COVID actually is looking at procurement more generally in the council. So I think what we'll seek to do is take an overview on procurement more generally, and then some specific looking at procurement around Medigold. And then coming up in May, again, provisionally have a public health update and a corporate services update, but those two very much dependent on how things progress over the next weeks and months. But what we'd like to also look at, because it's coming up in a timely way in the forward plan, is looking at major projects update, and including York Central, because the timing's about right for our quarterly update that we would usually have on York Central. The other thing to just update you on is there's a commission slot at the request of Councillor Widdowson on the 25th of March. The Economy in Place Scrutiny Committee will be looking at waste services update. So it's great that we've been able to facilitate that. And then just more generally, I am going to be meeting, I'm going to CMT on Wednesday just to talk about scrutiny and how scrutiny is being supported from the corporate management team perspective, and what we can do to try to get as much meaningful work done through scrutiny over the next few months. And I think one of the things that we're looking at is trying to think about how corporate directors can feed into the process. We've already got reasonable working relationships with the exec members in terms of feeding things into us that they'd like us to look at, but we're also then looking to see how we can take the officer input as well. So I think that is all fairly self-explanatory. Happy to take any questions on any of that. The other update to give you is that you'll be aware that the Constitution is being reviewed and updated. And so the chairs and vice chairs of all the scrutiny committees are going to be meeting on the 17th of March with a view to looking at the parts of the Constitution that relates to scrutiny specifically. And any outcomes that come from that meeting will be fed into Audit and Governance, who meet in April, I think it is, early April, to look at the Constitution overall. Committee members, we're just trying to work out what the best mechanism is for getting your input and whether or not it comes through groups, because I think each of the groups will be consulted on the changes to scrutiny, or whether it's best coming through the committee chairs. What we wanted to try and avoid is duplicating it so that it's sort of coming in from all angles and then A and G are not able to make sense of it. But we'll update you as and when we can with that. And then the other thing that I just wanted to put on your radar and flag up and be thinking about is the ethical disposal policy and the next steps that we want to take with that. So members will recall at the end of the call-in meeting on the 21st of December about asset disposal and specifically around Oakhaven, we passed a resolution that said that we would request for an appropriate scrutiny committee to undertake some scoping work with a view to developing a strategy for the council on the ethical disposal of its assets. And so what I'm proposing that we do, I've discussed this with Councillor Fenton as to the best way forward, and we're proposing to establish a politically balanced informal working group. I think probably looking at about 3 members, and I think because of the way that it sits, happy to take people from either CSMC or potentially Economy in Place. And the idea being that those members would take forward a sort of loosely termed piece of scoping work. We're just having to be a bit careful around terminology because there is a framework for a scoping report that comes to committee that then gets taken forward and there's a particular route. And unfortunately, we're not in a position to be able to undertake that specific route at this moment in time. But what we're looking for is 3, possibly 4 members to start setting up some interviews with relevant officers and exec members, identifying what currently exists in relation to asset disposal policies within the council currently, and also thinking about how we do things like procurement. We have ethical procurement policies. Are there bits of learning that we could apply to an ethical disposal policy? Also looking at gathering some information on what other local authorities do. We don't know at the moment whether other local authorities have these sorts of policies in place, and if there's a good bit of work somewhere else, can we pinch it basically? The working group isn't going to be asked to come up with any specific recommendations at this moment in time. The idea is that it will pull together information, bring that information that it gathers back to CSMC, hopefully in a relatively short time frame, and then we as a committee can decide what we want to do with that information and how we take it forward. So I'm not going to kind of spring it on you right now to ask you to stick your hands up and volunteer, but what I would very much welcome is just over the next couple of days, if anybody who's interested in taking that piece of work forward could indicate, just drop me an email and we can get that set up. I'd also ask Councillor Kilbane if you could just circulate something around your committee to see if there's any interest from any of your committee members. I've slightly paraphrased a paragraph that Councillor Fenton kindly drafted for me following a conversation, which I'm happy to forward on to you, Councillor Kilbane, so you can kind of give the same information to your committee. And then, as I say, ideally over the next 3 or 4 weeks, if we could have 3 or 4 members to start undertaking that piece of work with a view to coming back with some ideas as to how we might take it forward. I think that would be really constructive. So unless there's any questions on any of that I've given you, I think we're pretty much at time for the meeting. I'm not seeing anybody indicating a burning question. Very happy to take questions by email afterwards on any of it. And like I say, if anybody is interested in taking that piece of work forward, if you want to just drop me a line, I can see if we can pull together a group of councillors to move that on. So all it leaves me to do is thank you all for your time and input this evening. Thanks also to all of the officers who've attended, and in particular the technical team in the background for delivering a smooth running meeting, and we will see you all next time. Thank you very much.
Thanks, Chair. Thanks, everybody.